The Families Matter program, FMP, is an evidence-based, parent-focused intervention designed to promote positive parenting and effective parent-child communication about sexuality and sexual risk reduction, including risk for child sexual abuse and gender-based violence for parents and caregivers in Nigeria.
Family Matters program
FMP recognizes that many parents and guardians may need support to effectively convey values and expectations about sexual behavior and communicate important HIV, STD, and unplanned pregnancy prevention messages to their children.
One of the goals of the Icares project that the FMP holistically addressed was in terms of prevention of new infections. And how did the Families Matter program address this? Just like I said, it increased the parents' awareness about risk their children face at an early age, raising the awareness about HIV in their communities, sexual risks and exposures that these children are faced with, and enhancing positive parenting skills to ensure that these children are able to speak to their parents, discuss with them that the pressures that they face, and then it gave the parents the opportunity to interact better with their children, to know the pressures that they face, and develop a parenting plan for how they can handle these pressures.
Family Matters program aluwe 1 year na zama pinanda hidi na guvan shin mai unada gbidena shin nada hidi mata na olamuwe anti gbidena himata kwa momo de nyon shumana ga momo kona mo tuma minya mo pinina after mo pinina mo be ya shimo hide mo gwana kwa mo mola na melu na ile na kwa na gbidon kwa adevi shimaga hide vava wonu ade ne yoso na ga anti himata kwa anti na gbidon kwa
APIN Public Health Initiatives, as a key implementing partner for the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the U.S. Centers for Disease Control and Prevention, CDC, works with parents, guardians, community-based organizations to provide technical expertise for the adaptation, implementation, monitoring and evaluation of FMP.
Some of the steps that we did is to following trainings from the master trainers from Kenya and other countries. The Center for Disease Control, who are major funders of APIN Public Health Initiatives, had the training of trainers for these people who deliver the Families Matter program and are called the Family Matters program, FMP facilitators. Those facilitators is usually made up of a group of a male and a female pair, and then they deliver these things with fidelity to the manuals.
The ultimate goal of APIN Public Health Initiatives Families Matter program, FMP, is to reduce sexual risk behavior among adolescents, including delayed onset of sexual debut, by using parents to deliver primary prevention messages to their children and increasing awareness and protective strategies against child sexual abuse and harmful gender norms that may lead to violence.
Eve yo yamielu gwam nyi gwam pa ne be mlu ha she chian pa Family Matters program ka mo she chian ga kiri nyi gwam ga ko mumi ye angria Family Matters program udido awasin uko tumbu wa lamne mba ye ya o molun we no mu do ga ya yangi sulu na hanga kwa ka program ne anna ingiru mobe no mama tumbuwa siru do.
Beyond equipping caregivers with the skills to support their children and guide them to avoid high-risk behaviors, FMP empowered caregivers to become positive role models and provide a healthy, stable environment where their children can grow and thrive.
She won't bring she mahamba, you won't do by every day the young for young wonga. Kwa yanu young won like Bocana and the member you and Vihum by ye. Now I could be like one nogo. Mungo call no napin. I was in a pin. Ninan. It just in it just in them Zwakwa, Kema, Kuala was some caught you. Joe can of him. Ide lu ha motege lu ha wan gba ni ba gani pa alune ilu epin gaya mo ve tumbu wan chi yan su san kwaka epin binave mo ve tumbu wan chi si hide si bi yo mi on ina ha ide lu ha motega chi ye ton yen tabi ne shima wele ton ne hagba shima ide lu ha motege lu wan gba ni ba gani pa gia moya ko mo eleve yan faga. Come even Jimmy for you are yen, ya can't do any. Jachuku, he was in a family program, gay more, he gone till hen and a young lady with the children, she mahana, she if you put back when her. Alone can't gay. I say she was alone done him, willing and tone, a bush my one to push a cool ane. I say, ne youngie delun would take a one banning back doing it.
For the 4 years period that APIN implemented the waves of the Family Matters program, there was not a wave without laudable success stories. Starting from parents giving testimonies of how they are now able to communicate better to their children, to testimonies of children who have come up with, to share with their parents, ordinarily things that they would not have told them in the past. And so generally it was what I can say for these 4 years that implemented the Families Matter program to over 15,000 caregivers in Benue State and in Lagos State is that indeed families matter.